So good morning, everyone. I welcome you all in this session of our Sunday Mastermind. Today, golden nugget that I have taken is post-COVID complications, now popularly known as long COVID. And you might be, going through a lot of articles, researches, and the discussions going on with long COVID for last maybe about fortnight or so. The topic is getting further intensified because right from Europe to US, right from Russia to Thailand, this long COVID is something that is emerging as one of the biggest health concerns for people, not only for doctors, for the government, but also for centers which are actually trying to take this as one of the rehabilitation, one of the solution kind of thing. For that matter, I was just reading that in Thailand, where now the COVID is at peak. Now in Thailand also, there are a lot of special therapies created just to deal with this post-COVID complication or long COVID, whatever we call it as. So I thought I will take this as our golden nugget, and we will take that out. In fact, quite a few people here in this group had gone through the COVID suffering, right from R.V. Prasad Saab, right from Dr. Surya Narayanan. I think we have got a series of people who have actually been unfortunate to really experience that COVID. Not only them, but their family, their relatives, and those who have not gone through, their family relatives and all that. So there is a concern which needs to be taken up, and I thought I'll take this topic. Shall we start? Can I just have a response in the chat box?
Yes, sir, you can go.
Great. So this is the topic I took, which is post-COVID complications, known as long COVID. Now, this is basically long-term effects of coronavirus after your recovery. So say about 7 days, 14 days, or 3 weeks, whatever was the recovery period, and it was, turned negative and everything was fine. If there is any, I say any, complication which is getting developed after that or being experienced after that, directly or indirectly, it could be subtle also, it could be some indirect connection also, but if that is happening, it might be long COVID. It might be due to COVID. That's what is the concern. And that is getting weird because it is kind of coming up with different symptoms and different reasons. So many of us were affected, and those who were not affected, their relatives were affected, their friends were affected, their colleagues were affected. So in short, we were affected indirectly, and someone near or dear of us was actually somehow affected this particular thing. They were somewhere affected, and they were affected for a week, fortnight, 3 weeks or so, and they were there. Now, few people might think that I was not affected, I was not suffering with COVID, and when I was not suffering, I think it is a good topic and it is good thing to know, but it is not directly concerning me. And that's where I'm trying to tell that is concerning each one of us. Because one of the research says that 50% of Indian population were actually exposed to COVID. And they were asymptomatic and they did not know it. 50% is what the data says. Now, if that is the case, then what is happening is the body has developed antibody. The COVID was there, COVID came and went, and you did not know it. When you did not know it, you are also the same as the one who actually suffered from COVID. The only thing that the symptoms were different, their positivity was known, and they have come there. So to say, what I'm trying to say here is that anyone who has suffered from COVID, anyone who did not suffer from COVID, has got lot to do with this long COVID, because this long COVID is getting on a different frame altogether. And last 15 days, if you have been noticing, the researches, the things have been intensified. I was told that in US, I think few $1 billion budget is allocated last week. I'm not knowing the figure, but it is billions of dollars allocated just to intensify the research to find out the symptoms and what to do for long COVID. So it is just to find out. There are billions of dollars being spent, and there are things. So I thought we'll take this deep. So I have so many case studies, and that's what makes me more pro on this particular topic. And case studies is how that I am a wellness strategist and not a doctor. When I'm a wellness strategist, what happens is my friends, my relatives, my distant relatives, my colleagues, my classmates, each one of them somehow understands that I could help them. I could suggest them something better. Clubbed with, I'm into wellness supplements and I'm into health checkups and things like that. So those domain also understands that he could suggest something. And in my nature, I actually would try and go and talk to people and help that out. So what has happened is in past maybe 1.5 years, I have been continuously talking to people. Quite a few webinars I have taken, special webinars I have taken for my friends and colleagues, and I have done a lot of things. So what happens is anyone who is not well, or someone's ke family mein kisi ko kuch hai, someone has got COVID in distant relative, somehow I am consulted, I am being talked, and I'm kind of just helping them out, what is good, what is not good, and things like that. In fact, Dr. Kannan, who is expert doctor, who is not here in this group today, but he is doing a fabulous job as far as COVID treatment is concerned in his hospital at Chennai. And his entire hospital is COVID hospital, and he is dealing with all critical cases and all that. So many friends and relatives of mine, so many, not one or two. I think I have been consulting Dr. Kannan for the medicine, and Dr. Kannan sends the medicine detail in the WhatsApp, and I send them in WhatsApp, and we then triangle and talk, and we do all that is just to help people out. A lot of people who have recovered, we actually keep talking, keep changing their mindset, their diet, their pattern, and things like that. So in the process, what I want to say is that I have actually gone through a lot of case studies कि किसको क्या होता है, how things are affecting people, and that has given me a different insights. And in fact, this long COVID and all that intensely being talked about maybe a month or so, and I have been actually thinking and talking that for about 6 months now, because the cases I used to get, I was finding that it was not a weird case. If someone is talking about one symptom and I say that it cannot be symptom of this, and then there is another guy who is talking about the similar symptom, and there's a third guy talking about the similar symptom, and all of them are my friend, colleague, distant relative, and things like that. I'm kind of finding a common thread, and I'm understanding this is something that is connected to that particular, the post-COVID thing that I'm talking about. And that is how name is given today, but then this long COVID stuff was already there. And I'll tell you what kind of things. I mean, one is a weird thing I'll talk about. One is that eyesight. Can you believe that this eyesight can be affected by long COVID or post-COVID implication? I had got one friend who has never got, in fact, his wife used to always tell that at this age, maybe about 48 or 49, he will take the needle and he will put the thread in that and easily, and he will keep it. He has no glass. He does not have any one in the family member who has got glass, right from his father to someone. And he would read anything and everything, whatever minute. I mean, when you take his phone or you look at his MacBook and things like that, you will find that this person is having the highest resolution of his screen. The highest resolution. It is so small that you can't look at. I can't look at. So I don't wear chasma, but I can't look at. That is the barik font he uses. So he's perfectly fine. Can you believe that September last year he was COVID positive, and after he recovered, he was perfectly fine, fantastic. He's doing his work. Everything is fine. No complication. And since December onward, his eyesight is changing. He has been visiting his ophthalmologist, and he is, changing his what do you call it, glass ka number he is getting, and he has got today 2 chasma, one chasma like this for near, one chasma is for distant, and all that is happening. Now, this was something strange, and no one could relate, including his ophthalmologist, with the COVID or long COVID. But then I got a couple of other cases, and when I figured this out, this is the situation where this is happening. I mean, people are getting affected. So this is very, very serious concern. And we talk about the symptoms. This is weird. And therefore, I talked about this. This is in inverted comma, where you are actually, not noticing. I mean, you are not knowing that what is happening. So these things are happening. I think here a lot of people are there. Like here, you have got R.B. Prasad sir, you have got Dr. Surya Narayanan, you have got Adeshwar. Everyone was suffering, and everyone could kind of, I would have the experience session after end of my slide, and we would get some value addition there. So post COVID, when I talked about this, was something very strange I found, and I found that there are a couple of people in my case studies, they had the eye problem, and I found that this is strange. And coincidentally, I was reading one research paper, and I found that eye sight issue in Europe is being noticed in the clinic of ophthalmologist as post-COVID complication. So long COVID, eyesight is a topic. So this is now connecting the thread. The another topic I found was diabetes. People who have got no diabetes thing, their HbA1c is always 4.5 and 5. Their family history has got no diabetes, no symptoms whatsoever anytime. People have actually turned diabetic. Their HbA1c has shooted up to 7, 7.5 and all that. And it has happened suddenly. 2 months, 3 months down the line of the COVID, they turned diabetic. And suddenly doctor said that you have diabetes, not even pre-diabetic or something, you have diabetic. This is what diabetes, that is what happened. So this is very strange. Couple of other strange things I'll tell you. One is, sharp decline in your vigor and vitality. Sharp decline. Suddenly you start finding that this is different. You find cardiac complication. It is very common that you have got, cardiac complications happening. Heart muscles is getting weaker and things like that. You have got joint pain. And this is very strange, where joint pain is started happening to post-COVID people. And joint pain is, being treated as, post-COVID effect or something. And over a period of 2 months, 3 months, it is established as arthritis. That means it started with a simple joint pain, post-COVID complication, and it got established by the doctor that it is now arthritis. And you'll be surprised to know that the research papers are confirming in last actually 15 days, 1 month kind of time, when long COVID is getting intensified in your research, it is getting specified that people are getting started with simple joint pain, and they are getting established as what you call is arthritis. And this is long COVID effect. This is post-COVID. That's very strange. Rapid weight loss is another very strange thing which I have found in quite a few people. One of my nephew is going through this. So what is happening is suddenly you start getting weight loss, and initially it was very pleasant experience. They found that okay, I mean without doing anything I'm losing weight, so good. So I perhaps he's or she is giving credit to maybe diet or maybe discipline which they never had and all that. But then very soon they started realizing it's going down every week, and it is going down differently and going down to almost 10 kg, 12 kg, and for no reason. So that's another strange thing. Women health is another concern, because women health, out of the blue, they are finding something new, something suddenly new. Anyone who has suffered from COVID, long COVID effect for the women is altogether different. Right from their cycle change to their pre-poning of the menopausal to something, and all weird things are happening. So that's happening. And there's another thing which is very strange I found with 2 of my cases, where intolerance to heat and cold, complete intolerance. A small heat, a small cold, complete intolerance. They're saying that when you put the AC, you got to another 3 minutes, 5 minutes, you got to switch off the AC because you're not able to tolerate that. And even if it goes 2 degrees down, you're not able to tolerate that particular heat, which was a normal heat so far. It was just a normal temperature. You're not able to tolerate. You're saying that, oh, bring that something and open that window, or maybe put the AC on or things like that. And the moment you put that on, you again 2 minutes, you find out that, okay, shut this down and do this something. So this is something that you are kind of getting into weird symptom. And today's mastermind, I thought I will talk about this symptom. I've done some study for you, other than what I have got those case studies with me, where I have been, talking, consulting, advising people. So I've got all that put together in a packed few slides. And then I'm also going to talk about your experience, because here we have got at least about 5-6 people whom I know they were suffering and they are here. So we would figure this out. Couple of newspapers you might be reading this out. I've got a couple of cuttings for you. Post-COVID stroke, heart attack on the rise, that you are all knowing it out. And this is happening left, right, and center. A couple of celebrities you might be knowing, couple of news anchors, the sports person, politicians, doctors. You have found that they have suffered this, and things have gone long COVID effect, and the heart muscle has gone weak. The plaque and all that has got increased, and things have changed. Rohit Sardana was a news anchor, and he was a classic example. When he completely recovered from COVID, he started work, and he was perfectly fine, full of energy. And he, when got his heart attack and the death happened, it was found that it was his heart muscle which gone weak in COVID, post-COVID effect, and this is what happened. A lot of people you will find that if you visit cardiologists, I have one very senior cardiologist in Bombay, very, very senior with about 45 years experience. Now, I was just interacting with him in one of my previous interaction when I had taken my mother to him just to show him. And I was interacting. Now, he was talking about that the most of the people who are coming, they're coming with the symptoms and they never had. So they're coming as a first time symptom, and age does not matter. Even 28 years people are coming, 60-year people are coming, and they are coming for the first time that do not have any heart issue, and their ECG is not normal. The things are not normal, and they are showing different symptoms. And when you examine and you get into the detail, you are finding that they are suffering with CVD, cardiovascular disease, and they are into it. Right from blood pressure, shoot up, and all that is happening. But there's another thing, that if you already have the heart attack, cardiovascular disease, you already had hypertension, then you are more actually disturbed as far as the your symptoms and your conditions is concerned. What you need to know is one article I was just seeing. This is 9% to 23% of COVID patients are going to be prone for a stroke. That is what a study says. I'm talking about 23%. It's almost getting to 1/4 of the population. Which population? People who had suffered with COVID. And I'm saying that we should not look at that, okay, mujhe to COVID nahi hua tha, I should not be worried about. 50% of the population were exposed to COVID-19. That's what the study says. That means antibody was developed, COVID aaya tha, chala gaya tha, asymptomatic tha, pata nahi chala tha, and it was done. So what is happening is, this is for everyone. It's not to make someone fearful for that. किसी को डराने वाली बात नहीं है. It is more of getting concerned, being aware, and then taking things into perspective. So it is that way. Another newspaper cutting I got is type 2 diabetes emerges as prominent post-COVID symptoms. Those who did not have, their HbA1c was perfectly fine. That's what is happening. This is another weird one. I think a couple of you might have noticed it, and those who have not noticed it is happening, is hair loss. Is one of the prime symptom which post-COVID people are finding. So long COVID, hair loss is another one, right? That's happening. The another one is sexual dysfunction we are talking about, and that is big one. This is a G News article, but you will find that these articles are there, and when you look at the research, you would find a lot of research is being carried on this topic, because this topic is the concern, prime concern, and a lot of doctors in this domain are getting more and more and more patient every day, because post-COVID, this is what is happening. 4-fold surge in long COVID cases after second wave in India. That's what a newspaper says. And you would find that we are not knowing whether we are getting into third phase has started, or it is the residual or extension of the second phase is not known. But things are already there, and things are moving on that line. So this is the concern area. If you talk about another news, it also talks about 4-fold rise in patients with long COVID cases. This is Apollo Hospital confirms. And Apollo Hospital has got more number of centers, more number of case studies, and they are coming out with this kind of data. Another newspaper talks about NDTV article is 1 in 10 recovered patients had long COVID symptoms in Singapore. Now, in India, it is very difficult to arrive or get the precise data that how many people are actually suffering with that long COVID symptom. Because in India, by default, what we do is we tend to ignore the symptoms. We find ourselves as tough people and we tend to ignore a lot of symptoms that comes. But internationally, it is not so. Internationally, people notice it, that what is happening, how it is happening, when it is happening, why did it happen, and things like that. And if that is so, Singapore confirms that 1 in 10 recovered patient had got long COVID symptoms, post-COVID symptoms. Now, if that is so, then look at the ratio. It's alarming ratio. We're talking about 1/10 of recovered had got, visible symptoms. And we are going to discuss some symptoms which are not visible, which are not being visible even for 6 months. And then you are finding 1 or 2. So this is something that we would be discussing. Let us start. The long COVID I was talking about. I mean, this particular image which I got from internet was very, very creative. I loved the image because what it's talking about is you, and you have got various, impressions of you, and every impression has got a bigger complication, bigger pain, bigger, some kind of discomfort, and you are into that. And you are actually made to get stressed because that particular whole system is affecting you left, right, and center. You are thinking that you are recovered, it is all negative, but then it is still existing somewhere. As per recent data, if you look on researches and all that, people infected with COVID-19 can experience mild symptoms or completely asymptomatic symptoms. Same as, those the COVID time. So in COVID, someone would experience mild symptoms, someone will get into, ICU, someone would need oxygen supply, someone would do that, and someone will not have any symptom and they would be positive. Same way, long COVID, when we talk about, there will be people who will be experience something that they already had, they would find it intensified. Something they did not have, once in a fine morning, something will come from somewhere, that this disease or discomfort. Or maybe someone will not have any symptom, and later on it is going to change your life. So that's what the new normal, which was being talked about last year, is altogether different when we talk about this wellness scenario. New normal is going to be different for each one of us, because whether you suffered from COVID knowingly or unknowingly, it's going to be there. And it is all going to depend on one thing called how long the coronavirus lasts in your body. When you were suffering, how long it actually had, what was the symptoms it was giving you. It is based on that. It also depends upon person to person, because one person would have different scenario, one person would have different scenario. Body make, immunity, mindset, how happy they were, how stressed they were, what was the surrounding, what was the family structure, what was the medicine timing, and all that. It also depends on exposure to the virus. Okay, you were suffering, but what was the exposure to the virus, and what was the severity of the infection? Because that also is going to count. So this is all things which will count. Now, how that SARS-CoV-2 damages your body is all. I mean, whoever has been suffering, perhaps they have been doctor, because they have their own concern and they have studied that out more than anyone else, more than even the doctor, on internet, on books, on articles and things like that. So you know it out. But then when we talk about SARS and CO, it basically SARS. It actually spells as severe acute respiratory syndrome, SARS. And this SARS, when we talk about respiratory syndrome, acute respiratory syndrome, it actually talks about your whole lung system. It talks about your respiratory system actually. And then it does not just get restricted to your respiratory. It actually gets into your entire organs and entire systems. It actually gets into your blood vessels, it gets into your skin, it gets into your nerves, it gets into your kidney and heart, all cardiovascular. It increases the risk of long-term health issues that you might face with some or the other organs. So the more and more organs are getting connected with this particular one. When we talk about long COVID, what actually is long COVID? Post-COVID effect, long COVID is what? There's no specific definition of it, but if you have to, kind of just summarize this out, this is basically a condition wherein people continue to experience COVID-19 symptoms in a longer period of time that might be 6 months down the line, year down the line, or maybe 2 years down the line. Something, or maybe something complete silent. 6 months after that, you felt something because again, it was dis-ease. That day, the dis-ease started and the physical symptom appeared after 6 months. And then you noticed the physical symptom. It was there in your body. It was continuing as a thing, but the physical symptom appeared today. And you notice today that, okay, this is the rash, this is pain, this is ache or something. So it is a long tail of COVID, I would say. If it is long tail of COVID, perhaps that is why, who has given the name, I do not know, but internationally, it is now called as long COVID. So it is long COVID. As of now, we do not know why this is happening and why this is happening in someone and why it is not happening to someone else. Both have suffered from COVID. It is not known. Again, medical science says, or researchers say that the ones who has not got any symptom yet is going to get, because it is in their body and it is kind of working and things like that. So various studies actually are already being conducted. A lot of studies are underway to further investigate the long-term effects of this particular disease known as long COVID. And this long COVID is for everyone, including the people who have not suffered from COVID, because it is possible that they were asymptomatic and they suffered. So that's what I'm always, all the time highlighting at. There was an AIIMS study done just last month, June study it is. An AIIMS study on post-COVID complication, it was, talked. This is very specific. And what it talks about is that this long COVID is around 40% of patients had symptoms in first month. 22% of had symptoms in first to 3 months, and only 10% people had symptoms beyond 3 months. But the people who had got symptom beyond 3 months had got something of concern that was something bigger. I mean, the first, month or first 3 months symptoms were like, कि हमें थकान हो रही है, fatigue हो रहा है, कमजोरी हो रही है, and things like that, which over a period of time, by diet, by nutrition, by mindset, by exercise, by things, you could kind of recover and you are there. But the one who got after 3 months wala symptom, the 10% people who actually got something very weird. They got suddenly that I have got now cardiovascular disease. They got that now I'm detected with diabetes. They got something that I have got something, some problem in my uterus. I've got something in this. So this is something that changed their life. So the new normal was very, very surprising for them, very shocking for them, very much discomforting for them. So this is what was the research done by AIIMS. And long COVID had has over 200 symptoms. That is what has Lancet Study has confirmed in this perhaps last fortnight. And therefore, you would find that there's a huge surge in the articles and the research and the talks about this long COVID. This is all fueled by one thing, that Lancet Study. Lancet, as this is world oldest and the best known, what you call is general medicine journal. Now, Lancet is most respected journal, perhaps. So this Lancet says that 200 plus symptoms are there in long COVID. Which one you fall in is what you got to choose. Very surprising. And therefore, this 200 symptoms speaks almost this to that. You cannot have one symptom which is not mentioned there. That is how this long COVID talk is being talked about. That means it says that it makes you abnormal. Your new normal is not a good normal. It is that your body's capacity to perform, your body's capacity to resist the stress or virus or infection, everything is now compromised. Everything has a different degree now, and that degree is much below than what you should expect to survive, to live better, to be in good health. All the three aspects are changed. And that is very huge thing to happen. Once that happens, your way to respond to some discomfort, your way to respond to certain disease or maybe pain or ache changes. Your way to respond to certain irritation, your way to respond to someone who is perhaps, not irritating you, but you get irritated. The same traffic, the same spouse, the same colleague, the same employee was not irritating you earlier. The behavior was all fine, but now the same behavior is now irritating you. The same temperature, the same ambience is irritating you. And you are kind of, not. So that means your resistance to disease or condition is changing and it is drastically going down. That's what is happening. Once that happens, I think Lancet Study report 200 plus disease is all justified, because then if that is the situation, everything would happen and that will go. Major ones are what? Major ones are fatigue, they are exertion, they are joint pain, they are sleep disorders or sleep problems. I mean, you're not able to get good sleep. Itchy screen is another one. वो itch होता है, चकता आ जाता है, reddish हो जाते हैं, and things like that. You have got, changes in the menstrual cycle of women. You have got sexual dysfunction. You have got memory loss. In fact, less focus. I have got a couple of colleagues of mine who have recovered and they have been, complaining that they are unable to focus on something. They feel that their concentration power have gone down and they are, talking all that. Blurred vision. I talked about eye vision, and blurred vision is the most common one. And diarrhea, anything to do with your gut, because your 70% of immune cells are situated in your gut. And therefore, your digestive tract has got a lot to do with your lower immunity and post-COVID and things like that. When you talk about Lancet thing, there were a couple of things I, grabbed and took from Lancet report for you. Not to be discussed much because we are not doctors and we are not, talking about that medical science and the report per se. But I just grabbed a couple of names which you might, find things. So that's there on the screen, right from your body pain to joint pain to high blood pressure to fever to fatigue. The fever is frequent fever. That's what Lancet says. It says that month mein ek baar aapko aa jayega fever, that kind of fever. That means there is something there inside, and that's, figuring it out. You're talking about fatigue. You're talking about loss of taste and the smell. That too frequently. Kabhi aata hai, kabhi nahi aata hai, kind of. It talks about shortness of breath, difficulty breathing when you are actually doing a staircase, when you are actually running to your car, you are actually doing something, when you are trying to jog and things like that. Earlier, it was not happening. Earlier, it was happening after your 10 minutes, and now it is happening after you do it for 3 minutes. So things are changing. Coughing, chest pain. You talk about, your new onset of diabetes. That's what I talked about, a couple of case studies of mine, where people who were not diabetic, they suddenly turned diabetic. So new onset, I will call it. You have got all these things which I'm, reading it out. Rapid or fast heartbeat, palpitations we talk about. Dizziness. A lot of people are getting recognized and coming to, the vertigo symptom. In fact, I had taken my mother to a doctor for her high blood pressure topic last week. And he's happened to be a very senior cardiologist, and he actually checked and examined everything. And he kind of noticed that she has got developed some kind of vertigo in her age. But his first question was that whether she was suffering from COVID. I said, no. Now he says that, okay, out of curiosity, at last I asked that, why that you asked COVID thing while you were checking vertigo thing? So he says that most of the cases which is coming and suddenly turning into vertigo has got indirectly COVID, and somehow COVID se vertigo ho raha hai. So this is something very, very strange thing which is happening. And then you talk about, red bumps, you talk about, chronic fatigue syndrome, and everything is part of it. The list goes long. I have got another slide for you which talks about right from, a vein issue to neurological issue to gastrointestinal symptoms, which is loss of appetite, too much hungry, nausea, vomiting, diarrhea, abdominal pain, discomfort. You've got pancreatitis. You've got, pneumonia symptoms. You have got pulmonary function symptoms, arthritis, which I said that joint pain se shuru ho ke arthritis mein tabdil ho gaya, fungal infection, mucormycosis, and all that. So this is already being seen in India. So red fungus, yellow fungus, white fungal. So all that. This is one, which is another one. This again, a lot of Indian people are facing it. Most of them are still ignoring it, or perhaps thinking that it is a normal orthopedic problem, or maybe it is seasonal problem. And what it is known as a vascular narcosis. And this is what actually, this is the latest COVID-19 condition in bone tissues. In your bone tissues, this condition is getting developed. It is a disease that occurs when the blood supply to the bone is temporarily or permanently cut off. Initially, it is cut off temporarily, and when it is cut off, you get all sort of symptoms. Doctors dealing with this particular symptom, or maybe facing this kind of patients, say that this can be the next worrying trend in the recovered patients of COVID-19. So long COVID, this would be something rampant, because this is going to really cripple you out. So that is how it is. So this is another concern. This is one other concern which I was just doing some study to create this, session or slide for you. And I was getting deep into it because I was also working on one of the blog on this same topic. And I wanted to, get to the root of it. Something surprising I found, that this says that long COVID impacts on women health is tremendous. All the time fine women who have got no complication are now prone and getting into this, and that too appearing after 6 months, appearing after a year of COVID negativity. So this is a long COVID, that 10% which I talked about, that after AIIMS report that says that 3 months के बाद वो 10% लोगों में symptom आए, और वो symptoms, these kind of symptoms we're talking about. And these symptoms are mainly because the hormonal balance is disturbed, and disturbed with an impact. So the whole hormonal balance is disturbed, and when you get into the hormonal imbalance, it is leading to right from uterine, fibroids, to uterine polyps, to adenomyosis, to HMB, that is high, menstrual bleeds, and you talk about PCOD, you talk about anything for that matter, is more and more prone, perhaps like arthritis. You develop arthritis, you will be treated for arthritis only. You develop adenomyosis, you develop PCOS, you develop HMB, you develop fibroid, you will be treated for that only. But the trigger to get this started, or perhaps the cause to get that started, is somewhere else. It's talking about post-COVID complication. It's talking about long COVID. So that's what it is. Now the question is, what causes long COVID? COVID sabko hua, kisi ko hua, nahi hua. What causes long COVID? We do not know yet. The study has not confirmed that what causes it. Currently, researchers are not able to define the causes, but few possible causes which doctors are confirming, which research are confirming, or rather it is very obvious and the proofs are there, that says that poor immune function. Where did you stand when it happened? And after that COVID thing happened, did you change your diet? Did you change your way? Did you change your sleep? Did you change your exercise? Did you change your supplement? If you did not, then you were not the same immune person. You are not the same immune person which you were before COVID. COVID had broken things. When the devastation has happened, have you changed things? If you have not changed, then you are actually not, equipped to deal with the new normal. So that's one thing. The another thing is reinfection of that particular virus. When you have that particular virus, if it is getting reinfected, possible that you do not notice it, possible that this time it is asymptomatic, or maybe it is kind of coming it out without any symptom. It's already there in you. So that's one. The another one is multi-system inflammatory syndrome, which is known as MIS. So that is happening because most of the people post-COVID, if you go and check your C-reactive protein, CRP, you would find that it is not normal. Of course, CRP needs to be looked, conjunction with other reports and things like that. It has to be correlated with your other parameters. But then when you talk about increased C-reactive proteins, you're talking about, some kind of inflammation which is existing in your body. And inflammation is getting triggered by someone. The very unique study which already had confirmed that diabetes is caused by inflammation. Inflammation is the root cause for your diabetes. It is again the same logic here, that the people post-COVID or long COVID is getting diagnosed with new diabetes symptom. That means new cases. That means the inflammation is shooted up. And therefore, I'm talking about multi-system inflammatory syndrome is one reason. The another reason could be prolonged hospitalization due to your severity. If you were too severe, you were too critical, and you got to hospital and long hospitalization, that has created problems. So if you had long hospitalization, you actually had one single hospitalization, you are more prone and you had complication. Post-traumatic stress, because when you actually went through this process, when your family went, when your relative went, your employee went, all through this process, and you actually reeled through it, you actually have gone through too much of a stress, whether you accept it or not, indirectly or directly. Now that has impacted somewhere and it is there. One more possibility is the infection makes some people's immune system go into overdrive, attacking not just the virus, but their own tissues. Because that time, maro, protect karo, it is all in attack mode, your entire immune system. And that immune system actually attacks your own tissues because a lot of mimics has happened. The virus was mimicking things and things were at that level. Once that kind of damaging has happened, it is not exactly autoimmune disorder, but it is similar to that where things have been destroyed and things have been damaged. So this is one. And similar thing, it has got one more possibility, I'll tell you. One more possibility is the infection makes some people, immune system act crazy. Overdrive mein to gaya, but it makes you act crazy. When it happens so, what happens is the virus itself getting into the damaging mode and it damages your tissues, your cells, and it can lead to symptoms like brain fogging. It can, create a loss of a smell and taste. And the damage to blood vessels can take place. Damage to blood vessel can, create some problem with the heart. So CVD, the cardiovascular disease, the lung, and the brain problems. So all that can happen because of this long COVID symptoms. Another theory is that, fragments of the virus could remain in your body for long. It can be 6 months, it can be 1 year, and things like that. So the fragments of virus, if they're staying in your body, then possibly they are lying dormant and then becoming reactivated at points. So that's something. It could be another reason, and the more prominent reason is the wrong or excess medicine, or maybe the long hospitalization, and it is found as one of the reasons. So in India, it is quite prominent. In fact, most of the mucormycosis cases or the yellow fungus or white fungus were actually found the root as like that. So this reason is unnecessary use of steroids, causing post-COVID. When you actually were admitted, when you were actually doing something and the steroids were given, it was given by doctor is fine. But when it was unnecessarily given, then it, creates that kind of trouble. So how would you know that I have got long COVID? Because the Lancet says that 200 plus symptoms. So every day, whatever you feel that is, it cannot be long COVID. So how do you feel that it is long COVID? There is currently no test, absolutely no test to find out that it is long COVID. Instead, it is currently a diagnosis of exclusion. Diagnosis of exclusion. So you find out, okay, ye nahi ho sakta, so just exclude it, and find out what is remaining there. So it's ruling out other possible concerns and doing diagnosis of exclusions. In fact, it is more to read the body signals, reading the body signals carefully. Signals reading is one, and analyzing those signals. That aisa sar dard roz ho raha hai, read it, analyze it. Backache ho raha hai, analyze it. Something happening, analyze it. Find it out what is happening. Perhaps in time to come, there will be a test available, because the way things are moving, test available to identify whether you have long COVID. Maybe a blood test or something to test that this is okay. So this is long COVID, something like that. Like today you have got tests like, to find whether you have diabetes, whether you have got thyroid disorder, whether you have got iron deficiency, whether you have got, kidney profile, liver profile, all sort of things you have got, CBC and this and that. Somewhere down the line, perhaps this kind of test will also be there. Now the solution is what? What should be done? We talked about the problem, we talked about intensity of the problem, we talked about each one of us indirectly or directly are concerned, and this is a matter of concern for each one of us. But then what should be done? What are the strategies? What are the solutions? The solutions are not straight, not one line, because long COVID is manifesting in variety of forms, So the solution cannot be one point. The underlying pathogenic mechanism of the disease is not known to doctors also. So if it is not known, then how to treat them? This is difficult. So treating is still going to be a challenge. Actually, we are learning more about COVID, long COVID rather, every day. Long COVID effects or long COVID symptoms are being studied on a daily basis. And further Lancet add-on studies will keep coming. Companies will keep investing on that, and we'll keep, learning. More and more data will be available, because data are going to vary. Data of wave 1, wave 2, and third wave is going to be different. So it is going to be, changed. So this is how it will be. Actually, it's learning and eliminating things, that this has happened, and you then connect it out. So that's why I said that it is, exclusive. You keep excluding and it will happen. Long COVID can be present in many different ways, but most of the people experience fatigue. Most of the people experience, shortness of breath. Exertion is another normal symptom. Dizziness, concentration difficulty, constipation, pain, ache. There could be so many. Now I'm going to talk about 5 things quickly in 5 minutes that you should do. You should take this as a strategy, tips, nuska, whatever you do. And in fact, I have kind of, collected quite a few, and then wanted to zero down on 3, but I could not do that. So I have done it in 5. So here are the 5 ones. So this is quickly I go one by one. Number 1 is focus on the respiratory system. This was the problem with acute respiratory syndrome. So focus on respiratory system. Practice breathing exercise, pranayams, chest muscle strengthening exercise. All that will do. And you could kind of find best of the resources right from the online to your expert, who would tell you good yoga, good pranayam techniques, good something, but it is breathing exercise in short, and the muscle strengthening exercise that you need to do, whether you do pranayam, whether you do Swans Lena Chodna, whether you do Patanjali Ramdev, whether you do Sri Ravi Shankar, whether you do what you call is Sadguru, whether you do your Guru or my Guru, whoever you do, but then this is one thing. The another thing which you should do for focusing on respiratory syndrome, and this should be done on a daily basis. This should be done on a routine basis. You cannot afford not to do, even if you were not suffering from COVID. This is something that needs to be done, that needs to be started. So that's one. The second is work on the nasal cavity part of it, the whole your nasal cavity, and clear out any congestion if you have. Avoid you get any flu, cough, cold, and things like that. If it happens, take it very seriously and make sure that your nasal cavity at its best. If you are already suffering from sinusitis and things like that, be over conscious, over cautious, and be clear that it is not affecting somewhere. Nitric oxide model you should follow. A lot of sprays are now coming that you spray it, and nitric oxide you send it to your nasal cavity. But then when you actually do your Om and Amin and things like that, Charan, you vibrate your stomach and your chest and your this part, and when you vibrate that, typically the Brahmari pranayam, if you do, it actually creates loads of nitric oxide in your what you call is nasal cavity. So that's a natural one which you could do, the pranayam exercise itself. Go with some kind of kind of thing. And then you could also resort to things like neti, sutra neti, jala neti. The goal is to restore the lung capacity. And if you are actually a smoker or things like that, nicotine, complete no. Stop smoking, stop alcohol taking, anything if you are doing, that could be fatal. That could be something that you will not be able to repair. Right now, it is not identified. If anyone who suffered from COVID and is actually a smoker and continuing with the smoke, very, very risky and alarming scenario. You will not notice it anything today, but tomorrow something will come which will not be repairable. because that is what Lancet report talks about. That's what it says, that 200 plus things are going to come on the way if you are not still taking care of it. Here it is. Number 2 is stay relaxed. Stay hydrated all the time. To be relaxed, the number 1 theory is stay hydrated. I was just reading one of the experts' book on your skin beauty and your health. It talked about you keep sipping your liquid, your water, your green tea, whatever you want to do, or keep eating your fruits which have got a lot of water, like kakadi, cucumber, khira, your watermelon, your all that sort of thing. So it talks about to stay hydrated all the time. That itself will take care of a lot of things. Stay relaxed ka ye first rule hai. The second is do not overexert yourself with strenuous activities, whether it is your work, whether it is your relationship, whether it is your fun, whether it is whatever. Do not get into the strenuous activity if you were COVID positive. And as I said, 50% people were asymptomatic. They did not suffer, but they are still COVID positive. So they were COVID positive. So it applies to most of us that in new normal, we should not exert ourselves to strenuous activities. No stressing things around. No stressing people around. No stressing situation around. Tweak your business, tweak your work, tweak your scenarios, your table accordingly so that you try and avoid stressing situations around you. Diet plays a key role in keeping your mind relaxed. Diet plays key role. Have you heard of tamasi food? Tamasi food, it actually puts you in a stress. Food might be tasty. So therefore, food is going to play a role. Might be looking very simple. That food से क्या होगा? Food से बहुत कुछ होगा. If you really want to stray, पहला चीज होगा stay hydrated, पानी सिप करते रहिए. और दूसरा चीज food. Change the food you were eating. आपका डाइट प्लान पे फिर से बैठिए. न्यू ईयर रेजोल्यूशन को छोड़िए. अभी कोविड से बाहर आए हैं, फिर से बैठिए. 3 महीने पहले कोविड ठीक हुआ था, फिर से डाइट प्लान पे बैठिए. You are not normal person. You are not the same one. And none of us are normal now. New normal is different. So you got to change the diet, and what needs to be done is no junk, no fast food, spicy food, oily food, complete no. Trans fat, say no to it. Deep fried, high sugar, high salt, all that. Indulge in self-calming activities other than your food. Self-calming activities. Go calm. Do something, do anything that helps you achieve this self-calming thing. It can be music. It can be aromatherapy. Aromatherapy works wonder. It could be your steaming. It could be steam therapy. आप steam bath ले लें. आप कोई ऐसी equipment ले लें, कुछ और कर लें, कोई massage कर लें. घर में कोई massage करने का simple system रखें. घर में कोई आपके बालों में थोड़ा नवरत्न तेल डाल के ऐसा कर दे. Find out something of yours. Something might work for you. Something easy, something doable, something attractive, something interesting. Try something out and do that out. In fact, it could be reading. It could be, spending time with your near and dear ones. It could be your, very close friend. Spend some good time with them. Talk to someone on the phone. Do some video call. Do things like that. This will work. And there could be another thing, that develop some habit, hobby. Develop hobbies. And that could make you stay relaxed. Hobby is the one thing that can help you. And the best hobby to develop, if you can, is gardening. If you do gardening, it could actually help you stay relaxed. It is direct connected to scientifically on that, and we are going to take a special session on that in coming weeks sometime. That is a topic in my mind, that gardening has got a deep science which connects with your neurons, and it actually makes you relaxed, makes you happy, makes you more resistant, more calm. कोई आपको आके चिढ़ाए और आपके पास जाके वो भी करे, तो you will smile. That's what it can do, because you are actually connecting yourself with nature and things working. So we'll talk on that line. And this is the third one. Focus on nutrition and immunity. Your nutrition and immunity should be focused, because that is where the problem has happened. Your gut, that 70% of your immune cells were situated in, is kind of devastated. That's the word should be used. You are not noticing it, but it is done that way. So take a special care in terms of your diets and supplements. Make sure you are taking balanced nutrition, micronutrients, nutrients, everything in balanced quantity. Follow the RDA, recommended daily allowance of your micronutrients. Top up with, your energy producing nutrients. A lot of nutrients will be required for your energy. So they are energy producing nutrients. I mean, vitamins and magnesium rich foods, डार्क लीफी हरे पत्तेदार सब्जियां जो होती हैं, गाढ़े पत्तेदार सब्जियां, डार्क कलर के जो फ्रूट्स होते हैं, डार्क कलर के जो सब्जियां होती हैं, you can take that. Whole grains, no processed food, say no to it. Whole grains, eggs, lean protein कुछ आप ले लें, सोयाबीन हो सकती है, प्रोटीन सप्लीमेंट हो सकती है, नट्स हो सकते हैं, सीड्स हो सकते हैं, पल्सेस हो सकते हैं, फिश हो सकता है, some micronutrients like B2, B3, B5, B6, B12, folate हो सकता है, vitamin C, iron, magnesium, all that will help you reduce your fatigue and your tiredness. It will actually increase your stamina and it will make you more capable to deal with the day-to-day exertions and situations. You will not feel exerted. Aim for at least 5 portions of colorful fruits and veggies every day. If you can't get these fruits and veggies every day, you can go for some kind of supplements which have got all that concentrated in it, 1 spoon and you're done. So those kind of things you can do. You can take supplements, and quality supplements are available today in the market. And the fourth one is sleep well. Sleep is one of the thing that is badly hit by the COVID. And irony is that this is the most common one that is needed to actually deal with your long COVID. So this is very unique factor. The fourth one, the sleep, is one which every second person who has suffered from COVID would complain that their sleep is disturbed. They have developed insomnia. They have developed this and all that and all that. But this is the same sleep which actually is needed to rectify or deal with long COVID. So this is a big one. And best way to deal with this particular sleep is that you change the whole equation. Start getting to the root of the problem. Find out that what is disturbing you in that sleep, what is happening, and you figure it out. And then right from your diet to your ambience, to your sleep discipline, to your what your sleep protocols, everything you tweak and do that out. If needed, consult an expert or sleep therapist and fix this out. But do not keep this hanging, because the more sleep deprived you will be, the more inflammation will increase. And this inflammation is the only thread which actually is doing havoc for long COVID. Inflammation has increased, the immunity has decreased, and CRP has increased, and that's what is happening. And sleep is the only medicine which is going to bring your inflammation down, down, down. And therefore, you must have 7.5 hours ka minimum deep sleep tayari, out of which 35% deep sleep you will get. If you're not getting, you get into that. There are a lot of people who would actually say that post-COVID, I'm not finding any difference in the sleep. I would suggest check the deep sleep and you will find alarming changes. So get the deep sleep measurement done and do that out. And I talked about 5 strategies, and here is the 5th one. And the 5th one is add laughter. And I would say add laughter in everything that you do in your life every day, and add laughter in every hour of your day. Add laughter. कुछ भी बहाने से एक laughter उसमें जोड़िए. Without a laughter, that hour is wasted. The day is wasted without that laughter. Put this in your mind, and then you do that out. Laughter does not just lighten your load mentally, it actually induces physical changes in your body. This is science. And when it induces physical changes, it actually deals with your long COVID situation. Laughter enhances your intake of oxygen-rich air that is needed by your lung post-COVID also. And it actually stimulates your heart. So your CVD, so heart stimulation is being done. Lung and muscles are being stimulated. It increases the endorphins, and it releases endorphins in your brain. It activates and relieves your stress response. So you are able to respond better. You're able to absorb things better. So it creates a cushion to you. It soothes your tension, and laughter stimulates circulation and aids muscle relaxation. So your muscle relaxation takes place, your circulation gets better, and it finally soothes your tension. So laughter is scientifically proven stuff which we have forgotten. And when we go through all that, if suddenly you are declared with, a problem in your some organ, or maybe you are declared diabetic or something, already stressed, already surrounding is stressed, job, business, salary, everything is stressed, and suddenly you are again stressed. So laughter you have actually forgotten. So you've got to learn, you've got to start learning that how to laugh. And that's the solution. So the solution got to be bought. So laughter improves your immune system is an established fact. So all that laughter benefit when we talk, one benefit is intact benefit that laughter increases your immune system. Every time you laugh, you actually build your new cells and immune cells. So you build new immune cells every time you laugh. Every time you thake lagate hain, every time the new immune cells gets created. So that is how it is. So this was about today's session. I think I took complete 1 hour of yours. So less time remaining. But then still, I would suggest that couple of you who have got real life experience would share things, and we could add value on that.
Rajesh sir.
Yes, sir. I'm so sorry.
I'm Surya Narayanan.
Dr. Surya Narayanan, first of all, I'm
yes.
so sorry that your material got delayed. It is now reaching, perhaps.
Yes, I got a Nutrino Immuno. It is wonderful. Thank you. But they have not collected the money. Please send me the link.
No, this is sent on prepaid mode. It is sent on prepaid mode, so they will not collect.
And the additional slide you send me, I will pay that. Two, actually, you know well that I suffered due to COVID. I feel the recollection capacity. Say, for example, I had a lot of experience. Cristiano Ronaldo, now I'm able to remember. Previously, I'm not able to tell Cristiano, I'm able to tell Cristiano, Ronaldo, I have forgotten. So that type of problem I face. More than that, when I call my office staff in intercom, I try to recollect. See, those who knows me last 3 years, 5 years, I'm not able to get that name. That problem I had. So what I have done.
We talked about lack of focus. That particular point in time, your focus is not coming. You are distracted.
Okay, what are the problem? See, for that I have done potentially, that is breathing fast. The air will go fast to the brain, like that. So I have done. I have a doubt. Is it correct of doing like that?
Yes.
And how do we? I undergone a complete check around 120 tests under Thyrocare after 30 days, maybe in June 15, after 30 or 40 days. Even you can charge me. I am ready to send you the entire report to you by WhatsApp. You can because you have to charge. Otherwise, there is no purpose of sending and wasting your time. And you can really tell me what are the things I have to do.
Sure.
Most of the things I saw that normal, except vitamin D. And the pre-diabetic, it has come. And the pre-diabetic I'm having for so many years, 3-4 years. But everything is normal, BP, everything is normal. I find the only problem I have recollection. I'm not able to focus. Generally, I have the focus problem. Now it is aggravated. Anxiety is also aggravated. The anguish is aggravated. I went to the doctor suggested me. I went to the psychiatrist, one Nambi Narayanan, who is famous in Chennai. I went to that. He prescribed 2 medicines. That also I will share with you. Okay. And thank you very much. Nutrino Immuno, and the Digicel, and the 3 that what is called. I'm not able to recollect that seeds. That is called. I'm not able to recollect.
Yeah.
What is that? What is that?
I'm not remembering which one is saying.
That is a medicine which is it is terra feeds something. Just to see that. Previously I used to recollect, but I'm thankful to you. I want to be used with a natural and
follow the natural techniques which you are already doing. I think it will improve. It will improve. Only thing we need to be aware about it. We need to make sure that our diet, our exercise, our lifestyle is with the new normal model. We should not then get into life race and exert ourselves, compromise on the diet and the time and all that. This will be very, very fatal.
That is berries.
The
That is
objective of
berries.
this session is
That is berries. That is berries. That is berries. Berries.
okay.
Okay. How can I find my long-term COVID problem?
Sorry, sir.
How can I find that I have a long COVID?
So that's what I said. It is not no test declared yet, but experts are saying that you start reading your body signals, like you are reading that while you are talking on extension, you picked up the phone to call someone, and when the phone got connected, you are not recalling who is that person. Naam nahi yaad aa raha hai. So what is happening is this is that symptom you are reading and you are discussing. That means half purpose is already done. So read the signal, analyze that, and get into that solution, because every symptom has got some connection with somewhere. And one thing to be taken out of this session is that we are not normal. It is new normal, and new normal mein nutrition level should be different, the rest level should be different, the exertion or stress level should be different, the lifestyle should be different. If you are not different, not improved, then you will suffer it out, because tab tak kafi late ho chuka hoga. That's what.
One of the greatest lecture you are given for me. It is highly helpful, and I'm saluting 1,000 pranams to you for your greatest
Thank you so much, Dr.
teaching you have done.
Thank you so much.
Thank you.
Send me your report, and we will be again talking on that personally.
So it
Yes,
was,
sir.
you talked about the
Sir.
tamsi bhojan.
Yeah.
You talked about tamsi bhojan. So whether non-vegetarian is under tamsi bhojan or
Not
sattvic
really
bhojan.
non-vegetarian. I'm not very expert of that word or domain, but whatever I know is that tamsi bhojan is not only that bhojan of non-veg. Tamsi bhojan is also something which is giving burden on your organs. मतलब तामसी भोजन का मतलब हुआ राक्षसों की तरह खाना.
Okay. Overdose.
There is a restaurant. I do not want to take the name, or I don't even remember the name. There is a famous restaurant which has got chain all over the country, big time restaurant, which has got a flag system. So it says that कि आपका खाना जब हो गया तो flag को down कर दीजिए. If you feel that you are done, the flag is down. And it is such a thing that in your table itself there is a grill there. So you keep grilling, you keep eating, and you keep eating and keep eating. So that means एक आदमी 15 आदमी का खाना खा ले. वैसा system है. So now that actually whatever you eat there, it's tamsi bhojan.
Yes. Sir, I also got affected by COVID in the month of April, and just after that, I became diabetic.
Yeah, so that's one thing is already with you. The case study, you are itself a case study.
I become diabetic, and my sugar level shoot up to 350.
Okay, suddenly. So you did not have any symptom earlier, right?
No, not at all.
That is what is the trend which I'm talking about.
Never more than 80 or 90. Never more than 80 or 90.
So people who never dreamt कि उसको diabetes होएगा, they are turning to diabetes suddenly. That's what is that.
Now I have started taking medicine.
Yeah.
And it is reducing now, and it has come to now 146. Last week I got it tested.
Okay.
And it is 146 now. So I think by taking medicine, it is improving.
Yeah.
And the second one is my platelet level used to be more than 3 lakhs, 3.5 lakhs. And now it is only 1.2, 1.3 lakhs. Whenever I get it
that's not a big concern. It should be concerned, and you should be measuring, but it is not a big concern because it is directly connected to your immune model. And as last time I think we spoke, you should take the Giloy.
Yeah, I am taking, sir.
Any Giloy, you take the Giloy, 15 days, Giloy will triple it out.
Yeah, I am also taking papaya juice.
Yeah, that will be great. Yes.
Yeah. And overall, now I am feeling okay. No.
Yeah, your face is already speaking. I think last time
tension,
we had you in the session.
Relaxed.
Today, it's
completely
more than relaxed. I think you are already charged up. So it is.
Yes.
Your face is saying that. Great. Good to see you in that. So anyone else has got something to add here or give some kind of experience sharing?
Good morning, Dr. Sir.
Good morning, sir. How are you?
Very nice session. Thank you, Dr. Sir. I'm very fine. How are you?
Good, sir. Good, sir. Thank you.
Dr. I had to go out for an urgent call and I missed 4 strategies, 4 first before that add laughter. So can you please repeat those
So
quickly?
I'm going to post this on the thing. I'll just quickly run down the strategies. So first strategy was focus on the respiratory system because it has attacked on the respiratory. And I talked about in respiratory, you should focus on, breathing exercise and chest muscle strengthening exercise. The breathing exercise could be your pranayam. And I talked about focus on your nasal cavity area. And you talk about, nitric oxide topic. And then, Jalaneti, Sutraneti, whatever we had talked in earlier session also. And those kind of Brahmari, if you do, voila. So it actually does those lung capacity building and your nitric oxide topic. And we talked about second one was the stay relaxed, hydrate yourself, stay relaxed, music suniye, aromatherapy lijiye, relaxation kijiye, aap steam bath lijiye, whatever makes you relax. कोई हॉबी डेवलप कीजिए, गार्डनिंग कीजिए, ये कीजिए, वो कीजिए, सेल्फ कामिंग एक्टिविटीज कीजिए जिसमें सेल्फ काम रहे, because you are not the normal one, so you do that. The third one is focus on your immunity, focus on the micronutrients, focus on your diet intake and things like that. And we talked about you follow the RDA and things like that. And if the diet is not completing that, should follow the supplements and things like that. Sleep was the another thing which we talked, that you need to have 7.5 hours deep sleep, because sleep was something that is affected by every second person post-COVID. And sleep is the only thing which actually would deal with the post-COVID better. And the last thing which we talked about was the laughter. And we talked about how laughter is must for your immunity, and how laughter is much needed than earlier. And laughter is vanished than earlier. So laughter needs to be bought from somewhere. It might come from your some TV ka show or some kind of clip or some kind of joke or something. Perhaps the time has come that again you need to go back to get that Khushwant Singh ka joke ka book online somewhere or something. We'll have to add that. So my point was that if you talk about me, I keep talking about laughter in myself. Forget the lecturing. I talk about laughter so much so that happiness has become so much that a lot of my passwords somehow adds happiness as word. Happiness, happy me, happy you. I keep talking. But then with a lot of happy, still I find that I did not laugh today.
Okay.
Because you are in a scenario, you are getting late for one session, you are doing something, you are having a business problem, you are having employee issue, you are having this issue, that issue. So you're not into that mind at all. And whenever you're relaxed, actually, you are actually again stressed. So when you are stressed, it is not in your control. So I recently started thinking, when I keep thinking, so I started thinking, and I have come out with some technique for myself, and I'm trying to apply it out slowly. I've taken 4 weeks further time. By 15th August, I will apply that out. And from 15th August, independence, I'm saying that I'll keep independence to myself. Once it works for me, I'm going to, come back with pointers for all of you. That I'm saying that, how about adding laughter every day, once a day? It's James Clear theory. Do not plan big. Add one laughter जिसमें ठहाका लगा के हंसा था आज, और सोते समय ये सोचो, this day was wasted or not wasted. If it was not ठहाका, the day was wasted. The day was wasted without that big laughter. If it is that rule, then सोते समय देखेगा कि ठहाका नहीं लगाया अभी तक, तो वो एक मिस नहीं होगा. And then I'm trying to implement it every hour. That hour is wasted if you did not laugh.
Great.
So we'll figure this out. कैसे करना है? And I'm
nice.
thinking that if you apply this in your organization, like Devendra sir can apply in his institution as head of that institution, that if we do that even for 30 seconds, even in the good meeting, even in that classroom, how does it matter? Post-COVID, long COVID, this is the need of the hour.
Right.
This is the need of the hour because you're talking about the immune cells. How about the classroom? You see, I was just talking to one of my colleagues yesterday, and she was talking about her daughter and things like that, where the classes is running one-stop, 8 hours ka non-stop class. The teacher are coming, and teacher are just starting with the class. The students are students. अब क्लास के बीच में गैप भी नहीं है, इंटरेक्शन भी नहीं है, कुछ भी नहीं है. बच्चे के बारे में सोचिए, 8 घंटे तक बच्चा एक ही फ्रेम में है, हाई डिसिप्लिन. So what is happening is it is needed that उस ऑनलाइन क्लास में भी आप एक बार लाफ्टर डालिए, 30 सेकंड के लिए डालिए, कुछ एक कैजुअल करिए, कुछ कनेक्ट तो होइए. I think we need to do that. So I'm practicing that actually till 15th August. सीक्रेट था, बट मैंने रिवील कर दिया देवेंद्र सर के कहने पे.
So nice of you, sir. Thank you very much. Thank you very much, sir.
So what is aromatherapy? Just putting some aroma on.
Aromatherapy is fragrance. Every
just putting
human,
some fragrance on a skin or some cloth.
you can put anywhere. I'm telling you why I'm deep into it, because I have spent 3 days completely non-stop couple of years back in China, Canton में, Guangzhou में, on aroma stalls, because this subject is so close to me. Sleep and aroma, these two things I deal very closely, and someday in my life when I'm settled in my entrepreneurship, I'll actually create something around this. So aromatherapy, I found that most of the Europeans, Germans, were, camping there and noting this down, and they were buying the most of the stuff. And we Indians do not even walk into that pavilion. So aromatherapy is what, that every human being has got the sensors, and that is connected with some or the other aroma. मेरे को ये वाला अरोमा पसंद होगा, आपको कोई और पसंद होगा. Find out कौन सा आपको पसंद है. Find out which aroma you like. और वो अरोमा जो आप पसंद करते हो, यदि आप सही में पता लगा लिए, तो वो अरोमा आपको टर्न ऑन करता है, वो अरोमा आपको रिलैक्स करता है, वो अरोमा आपको एकदम बेहतर कर देता है, प्रोडक्टिव कर देता है, आपका कंसंट्रेशन बढ़ा देता है, आपका माइंड ठीक कर देता है, आपका आउटपुट बढ़ा देता है. अभी ब्लॉग लिखने लग जाएंगे तो पूरा ब्लॉग एक साथ में लिख देंगे आप, यदि वो अरोमा आपको मिल गया तो अरोमा है. आई हैव आइडेंटिफाइड माइन. एक बेली का फूल होता है, डू नॉट नो इंग्लिश में क्या बोलते हैं, हमारे नॉर्थ में उसको बेली का फूल बोलते हैं, द व्हाइट कलर फूल.
Yes, yes.
Now बेली का फूल ऐसा है कि you put the बेली का aroma, even artificial flavor, I'll become in good mood. That's something that I have noticed every time.
Okay.
Sometimes I'm irritated, किसी के मीटिंग रूम में पहुंचा, उसने वो रूम में फ्रेशनर मारा, बेली का फूल था, I'm happy. तो मुझे लगा कि this is working. Then I started finding it out कि कभी बेली का पेड़ के पास पहुंचा, इधर पहुंचा, I started finding कि this is working for me, this is there. So same way, everyone has got some aroma. The problem with aroma is most of the aroma available is in the form of artificial chemical flavor, chemically synthesized aroma. That might create trouble with you. It is carcinogenic, it will create irritation, it will create problem in long run. So follow the natural aroma. And when we talk about aromatherapy, we're talking about a steam bath, we're talking about massage, we're talking about some kind of diffusers. You Google diffuser in Amazon, you will find at least 20 variety of diffusers. Diffuser aisle आते हैं, essential aisles आते हैं. Diffuser के साथ refill आता है. And you take one refill of 10 ml or 5 ml, it will run for 3 months. I've got diffuser at my home. So what you do is you put one drop in it, close it. It will keep diffusing that aroma throughout the night, throughout the day in your room. So वो vaporize होता रहेगा थोड़ा थोड़ा अदृश्य रूप से. So these are the diffusers, aromas which you can apply, and body में भी apply कर सकते हैं. Aroma can be your soap, it could be your shampoo, it could be your oil, it could be your cream, it could be your lotion, it could be anything, could be aroma, but it is more of you treating your senses with that aroma.
Are the natural aroma available on some Amazon?
Yeah, lot of available, but the problem is that even the artificial or chemically synthesized one call themselves as natural. You do not know it. But you can very well find it. Best is to find from your garden. Best is to find from your lawn. Best is to find which one it is.
Yes. Okay, sir.
That's aromatherapy. So we are done with the session. All right. Wish you all a very relaxed Sunday, and we'll connect next Sunday again. Thank you so much.
Okay, sir. Thank you. Thank you.
Thank you, Rajesh.
For the great session.
Thank you. Thank you.